Hey everybody, this is Cheryl Harris with Cheryl Harris Enterprises. Today I'm back with another video with stroke conversations, and I want to talk about my recent diagnosis that I had. I don't know if you saw my other videos in the past there where it shows that I have very limited range of motion in my left arm, and because even though I went through occupational therapy and physical therapy, it wasn't the right kind of therapy that I had in order to treat the condition that I currently have been diagnosed with. So follow along with me on this journey. And in this video, I'm going to explain to you what I have and the different stages of it. And if you see me looking away or looking down, I'm referring to my notes, okay? So in my last video or my last short, I don't know if you saw that, I went to the Orthopedic a couple of days ago, and they did another x-ray because I had 2 x-rays within 1 week. They did another x-ray, and with that x-ray, they found that I had frozen shoulder. So as I was getting occupational therapy, OT, I kept trying to get the help to lift my arm and try to raise it up to a level of comfort or past a level of pain, and I didn't have the right therapy. So when I saw the orthopedic, they did the x-ray, and the physician assistant came in and said, I have frozen shoulder. So I'm going to talk to you today about frozen shoulder and what it is. I guess it's one of the symptoms that you get post-stroke therapy, because it's a situation where it's called adhesive capsulitis, and it causes pain and stiffness in the shoulder. And over time, the shoulder becomes hard. It becomes harder and harder to move. So over time, the symptoms could worsen. So frozen shoulder can get better with, although full recovery may take up to about 3 years, 1 to 3 years, depending on what I do during the process of my new physical therapy that I'm going to get. I'm now going to start getting new physical therapy. I have to set those appointments as well too. Okay. And before I move in, don't forget to like, comment, and subscribe. And I also post where I got this information from in terms of the resources and what frozen shoulder is. And if you know anyone that's had a stroke, and this could be, everybody's different. Somebody could get something else. I got frozen shoulder. I don't know somebody could have got something else. They could have got, and I also have hyperextension in my left leg, and a drop foot. I have video on that, how you can work out and exercise a drop foot. Okay, so frozen shoulder is commonly affected by people between the ages 40 and 60, and more so in women than it is in men. I didn't know that. That's very interesting. I wonder why that is. In addition to that, people that have diabetes, thyroid conditions, and they have a more increased risk of getting frozen shoulder. However, a frozen shoulder can happen to anybody. It can happen to athletes. It could happen to you after you've had an injury, after you've had surgery. All of that can come about if you've had those conditions and if those things apply to you. Okay. Now let's talk about the anatomy part of the shoulder, so you can kind of see where it could happen in the ball and socket joint of the shoulder. And there's 3 bones that the ball and socket joint is made up of. You got the humerus, which is the upper arm. You got the scapula, which is in the back. That's the shoulder blade. And then you have the clavicle, which is right here. And I'll insert some pictures here so you can see them as well. So you got the humerus, the scapula, which is in the back. And I try to keep those instead of making sure that I pay attention to my posture, making sure that I'm not like this. And I sit up like this to try to bring the scapula together, okay? And then you have the clavicle, which is the collarbone right here. So the head of the upper bone fits into the ball and socket joint of the shoulder blade, and strong connective tissues, in the shoulder capsule surrounding the joint. And usually what helps it move a lot is something called synovial fluid that's in between the socket and the joint. The socket and the joint helps it move like this. That I know because of me being a massage therapist for over 20 plus years. Okay? And that's what helps the shoulder and the hip and your knees. Any place where it has a ball and socket joint, synovial fluid is what helps it move smoothly. Okay? So I'll insert a picture and resources where you can look this information up as well too. Okay? So let me give you, there are 3 types of descriptions of frozen shoulder. You have stage, what's 3 different stages. You have stage 1, which is freezing. So the freezing, then stage 2, which is frozen, which is what I have. Then stage 3 is when it is thawing. I didn't even know this. I just found all this out myself. So the freezing stage, you move slowly, but in more pain. And as the pain worsens the shoulders, you start losing range of motion, which is what happened with me when I started getting those symptoms about 3 or 4 months ago. I was in the freezing stage because I was like, what's going on with my arm? I didn't know I was like that. I was able to move it right around at the 6th month because I was able to reach extremely high, take it to a lateral move, and bring my arm in and move it around, rotate it. I was able to do all that. I can't do that too much right now. I can, but it's very limited. Okay, so freezing typically lasts somewhere between 6 weeks to 9 months. That's the freezing stage. So again, you got freezing, frozen, and thawing. Okay? And sometimes the pain worsens, as the shoulder loses range of motion because it's not moving. And there are also some scar tissues that are in the ball and socket joint, which there is treatment for that, and along with physical therapy. The goal is to avoid surgery at all points, at all costs. Well, I don't think I'm at a stage, that's just my personal opinion. I don't think I'm at a stage of surgery, but if they're able to manipulate the bone and socket joint with ultrasound therapy, and break up some of that scar tissue and adhesive tissues that's in the shoulder blade, in the ball and socket joint. Sorry about that, y'all. Still working on my speech. And then you have the frozen stage. Now, the frozen stage, the symptoms could actually improve over time during the stage with the frozen shoulder. So I'm at the stage where the symptoms can improve over time as long as I'm doing the work and getting the proper treatment for it. Okay? But I still have some stiffness that may remain during that time. And during the frozen stage, that could take 4 to 6 months in the frozen stage for healing. So the freezing stage is 6 weeks to 9 months. The frozen stage is 4 to 6 months, in that stage. And during that stage, some daily activities could be extremely, extremely difficult. But again, I do the things that I need to do to try to keep it moving so it won't get super stiff. It's frozen. I want to get it to the stage of thawing out. So they really don't know what causes frozen shoulder. They've tried to get the information. They said they don't know what the cause of it is. They don't fully know. Remember, doctors are practitioners. They practice. So they have to keep practicing to find out and keep studying to find out why things are happening the way they're happening based on, the individual. Every person is individually diagnosed, and every stage of a stroke is different for everybody. Okay? We're clear on that? Okay, so now the causes of it, as I stated before, they don't know what causes. They don't know what it is. They don't fully understand the reason for frozen shoulder. There's no clear connection with the dominant arm as it relates to the less dominant arm. There's no clear connection if the dominant arm that does the most tasks is the reason why the frozen shoulder, it is the way it is. There's no real clear connection with that. They don't know. They don't know, y'all. They just don't know. So we have to practically be test dummies for them to figure out what they can do. So those are just a few more things that here are a few more things that could actually cause frozen shoulder is individuals with diabetes, other diseases that may come across it, and then medical diseases that cause frozen shoulders could include hypothyroidism, hyperthyroidism, Parkinson's disease, cardiac arrest, and diabetes. And of course, immobilization. If you don't move the arm as much, it can cause frozen shoulder as well too. Well, I thought I was doing everything I could possibly do during that stage, just to make sure I keep it active and keep it moving. And I was doing my part, definitely with the occupational therapy, the PT, physical therapy, and then my own therapy that I was doing. Okay. Again, so some of the symptoms are you have a dull and aching feeling. It's dull and aching. It's typically early in the course of the disease. When you move your arm, it typically is getting worse in the early. I'm sorry, y'all. Excuse me. It typically get worse early in the course of the disease, and when you move your arm, it's also located over the outer shoulder of the area, which is right here. This is the outer shoulder of the area. And sometimes the upper arm, which happened to me. Mine just happened to have a pain transfer. So frozen shoulder right here, and the pain transfer was right here in my middle deltoid. So you also have the muscle part of it is the deltoid. So I call them delts. And this is, kind of interesting to me because I love working shoulders in the gym. I could spend up to 90 minutes working the shoulder in the gym. Well, can't do it right now. I will later on though. Okay. So when I went into the orthopedic, they did an x-ray first, and then they did an examination. So the doctor would come in, or the physician assistant would come in and do a physical examination, which means they will do passive range of motion. Range of motions, which means instead of me moving it on my arm, they'll take it and try to move it and see how far they can get and see how far they can go with it. And then he took my arm and moved it. Of course, I jumped and like, whoa. And you can see my posture right now. I can see it in the video. So that being aware of that, making sure you be aware of your posture so you won't have any, and I'm going to put a pillow under my arm to make sure that I keep it level, try to level it as much as I can with the other shoulder. So you have to do the MRIs, you have to do the, MRIs is magnetic resonance imaging. So they do all kinds of testings and things for you to make sure they can see everything they can see that's part of the shoulder and give you the proper treatment and a proper diagnosis for it. So there's different treatments. I'm going to talk to you about the treatments. Now, the treatments, this segment, I'm going to talk about the treatment. Now, the treatment, it can be done and it can get better over time without surgery. It can happen. You don't necessarily have to go into surgery for it. That doesn't automatically pop, oh my God, I got to have shoulder surgery, depending on how severe it is and how well you improve over time with the physical treatment, the cortisone shots that they give you, or they can do an ultrasound, or steroid injections. They can do non-surgical treatments, okay? And most frozen shoulders improve relatively with simple treatments to control the pain over time, and also restore range of motion. One of the most important things is to optimize your health during this time and do the things, that might contribute to frozen shoulder. In other words, make sure you're not moving the arm. I know it can be painful, but you want to keep it moving. You want to keep it rotating. You want to do the things that can help you keep you moving. Because having a stroke will have your arm in the, flex position like this. And you don't want it like that. You hold it up like this because you don't want it to drop or you don't want it to hang, but you got to keep it moving so that it won't get worse with the pain. So there are some surgical treatments that you can do, which is NSAIDs, NSAID, which is non-steroidal anti-inflammatory drugs that you can take, like aspirin, ibuprofen, just to reduce any pain or swelling. Follow your doctor's orders. This is for educational purposes only, okay? Or you can do steroid injections, anti-inflammatory medicine that goes directly into the shoulder joint. So you can do the steroid injections, or you can do the cortisone shots. You can also do what is called hydrodilatations. I'll put the word up there. You can look it up. And hydrodilatations can be formed by a radiologist or a medical physician or an orthopedic surgeon, And it's a guided image, using the guided image to replace the fluids. I believe that's the ultrasound that I was talking about earlier. And in addition to that other non-surgical treatment, physical therapy that caters to frozen shoulder. Again, I had physical therapy, but that was just a normal physical therapy. It did not cater to the condition of my shoulder. Okay? So you got the non-surgical ones, you got hydrodilation, you have physical therapy. And I don't know what hydrodilation is, Again, that's the injection of a large sterile fluid into the shoulder. And they stretch the shoulder and the joint capsulations. And it can be, like I said, be performed by a sports medicine doctor, a radiologist, an orthopedic surgeon, and you can have physical therapy. So those are the things that you can get. Some of the exercises that you can do to help with the frozen shoulder. Again, make sure you consult your treating physician and physical therapist on how many repetitions you need to do. Consult your treating therapist or your physical therapist to help you do what you need to do. These are just some recommendations. Okay? You can do external rotation, which is you can stand in a doorway to have your arm out to the side there and stretch the arm out like that to give it, whatever stretching that you're able to bear during that time. So you can stand in a doorway and bend your arm of the affected elbow at a 90-degree door jamb. Okay? So have it like this and press against it. I'll demonstrate another time in another video. So you can do external rotations. You can do forward flexions. And I'll show you some pictures. I'll insert some pictures here that you can use towards that to help you. You can also do forward flexion supine position. I did those in some previous videos where you lay flat, you take the arm and bring it. Supine is turned up. That's your body. And then you take the arm back above the head and have the elbow near your chin. You can do that and hold it for like 30 seconds and repeat, and then relax and repeat, relax and repeat. Or you can do the crossover arm. You can do that as well. Hold it for 30 seconds. Those are some different exercises you can do. And the last one that you want to do, or hopefully it doesn't get to this point, is have surgical treatment. Again, consult your physical therapist, your orthopedic surgeon, and this is for educational purposes only. You make sure You move with caution in anything that I say on this channel. Even when I was doing my workout videos, consult with your physicians, therapists, and all that before you do anything, and make wise decisions, wise choices before you're able to move on, okay? So I will be posting or attaching some resources where I got this information from, so you can look at it yourself and look at some handouts and things of that nature. And just make sure you take your time with doing things, guys. Get the proper help. I always said, you know what? If it ain't one, it's for that child. Just take your time and keep showing up and keep moving. Okay? Just keep showing up for yourself. And again, I went to the Core Institute, CORE, the Core Institute. And I got this diagnosis, and with the x-rays that they had, and we're going to make sure that we do what we need to do to improve ourselves in a better manner, okay? And making sure that you follow your physician, you follow your physical therapist, you consult with them. I'm here to give you information. Again, that's all I have for you guys there. Those are all my notes that I have right there. If you have any questions, if you're experienced anything such as, frozen shoulder, if you've had a stroke, this is part of the post-stroke symptoms that I've had after I had my stroke. And I thought I was doing much better, y'all. And I am doing much better. I'm getting better. I'm doing better. But I just had a little hiccup in the road. So you just keep it moving. Again, you keep showing up for you. Show up for you. You don't just show up for your family. You show up for you, because I read and heard something that it's not that you're trying to get back to your old self. This whole situation is things that happen to you or happen with you is positioning you to become the new you. I've always said to people in my personal training videos, I'm not trying to change who you are. I'm just trying to change what you do to become better at who you are. Okay. So this situation, this whole ordeal, this whole stroke situation happened obviously for a reason. And whatever else is going on in your life happened for a reason as well too. So it's not that you're going to go back to the old person, the old you. You're actually becoming the new you. You really want to become the new you and do the best that you can. The only thing I say is put the effort in, put the work in. Don't just do mediocre work. If you do mediocre work, you're going to get mediocre results. So make sure you just keep showing up. All right, guys, this is all I have because I'll keep talking. All right, so make sure you like, comment, and subscribe to the channel. Thank you for stopping by and watching the video.